Okay, good afternoon to all. Today we'll start on with coronary artery diseases. So this is one of the most common type of heart disease. When the arteries that supply blood to the heart become hardened and narrowed, it will become narrowed by some of the other reasons. So this will result in the reduced supply of blood to the various systems of our body. So it may be due to the building up of lipids in the walls of the arteries. So these will result in the reduced supply of blood to various parts of the body, which results in the reduced supply of oxygen to all parts of the body. So how to prevent all these coronary artery diseases? A healthy, balanced diet will help in reducing the coronary artery diseases. You have to go for healthy food. The diet should be a balanced diet. Already we discussed something about the balanced diet. Limitation of alcohol intake. Alcohol intake also will result in the coronary artery diseases. Smoking, it will also reduce the diameter of the arteries, so it should be avoided. Regular physical activities will reduce the occurrence of coronary heart diseases. Because of the regular physical activities, all our systems will work properly, so they will help in reducing the heart diseases. The flow will be enhanced. The physiological changes in our body will be there by the regular physical activities. So it will also help in reducing the coronary artery diseases. Maintaining a healthy body weight. Body weight, you have to maintain your body weight. So the body weight will directly influence the artery diseases because of the supplementation of all these lipid profiles in our body will directly enhance. Maintaining a healthy blood cholesterol level. The blood cholesterol, the lipid profile. Whenever you go for this blood test, they will check the lipid profile. Cholesterol level should be maintained properly through proper diet and exercise. Then effectively treating medical conditions such as type 2 diabetes. Type 2 diabetes, the occurrence of diabetes will also influence the coronary artery diseases. Diabetes will are suffering from person suffering from diabetes will be prone to artery diseases. Blood pressure. These three are interrelated. Those who are suffering from type 2 diabetes will be prone to high blood pressure and also artery diseases. Those who are having high blood pressure also will be prone to type 2 diabetes and artery diseases. Being aware of the risk factors. If you are aware of the risk factors of the health conditions, your artery diseases can be controlled to some extent. You can involve in regular physical activities, you can have proper diet, then you can avoid the coronary artery diseases. Exercises, exercise prescription. What exercise can be given? Calculating the rate of perceived oxygen. This can be calculated. The amount of oxygen, how much oxygen you are getting, your body, how much you are inhaling, how much your body is able to accept. All these things will come under this. Then calculate the target heart rate. When you are going for regular physical activities, you have to check the target heart rate. For that, Cavonian formula is there. So you have to go to that target heart rate. You have to set the target heart rate. In that, you have to work to get yourself fit or to avoid any occurrence of this diseases and disorders. Then the volume of exercise. Volume is nothing but the total amount of exercise. How much amount of exercise you are doing is the total volume. Total volume that can be calculated per day, that can be calculated per week, that can be calculated for a specific time. How long you are working, like that it can be set, and the volume of exercise can be set, and from that you can uh, make yourself fit, and you can make yourself free from other diseases. Then the duration of exercise, how long you are going to do the exercise per day, how much duration you are going to do, how you are going to split the sessions, how many sessions you are doing, how much time you are going to spend per day. That is the duration of exercise. That also should be taken into consideration when you are going for regular physical activity. Then the mode of activity. What mode you are going to select? Are you going to going for aerobic exercise, or are you going for some indoor setup, strength training, or whether you are going to involve in some major games, dual games, individual games, like that? You can specify the mode of activity, that which is suitable for you, you can adapt. Better it's better to go for dual sports. You will satisfy your recreational purpose also. At the same time, you are involving in physical activities, that also will be helpful for the prevention of such diseases. Then strength training exercise. Strength training exercise are must to regain your strength. The suppleness, muscle suppleness, the suppleness of the muscle, the stability of the bone, all these things are directly proportional to the strength training. So strength training, it's a must. You can use any free weights or machine weights, whatever is available, you can go for strength training. You can use your own body weight as for strength training also. Own body exercises like planks, push-ups, pull-ups, like that. You have to design in such a way. Strength training is a must to avoid all these occurrence of all these diseases. Then repetitions and sets, that it depends the level of fitness. How fit you are, that will reflect in the repetitions and sets. Each set consists of how many exercises here, how many times you are doing, how many repetitions you are doing for one set, or whether you are going for 3 sets or 5 sets or more. The number of exercises also will be taken into consideration. That particular exercise, how many times you are doing, that is repetition, and one set consists of how many exercises, 10 or 12 or 15 repetitions, it will be the set. So how many sets you are going to do the same exercise, 3 sets or 5 sets, like that you have to concentrate, and you have to do all these exercises. Stretch for flexibility. If you want to improve your flexibility, you have to go for stretching exercises only. Only the stretches will help in flexibility. So you can accordingly you can do that. You can go for static stretches, you can go for dynamic stretches, or if you are not able to stretch yourself, you can go for passive stretches. You can get the help of the therapist or your partners. You can go for partner stretches. For some particular conditions, you can go for PNF, proprioceptive neuromuscular facilitation. That also you can go with the help of the physiotherapist. So stretches for flexibility is a must to maintain your flexibility. Then daily routine. Your daily routine will be taken into consideration. What type of work you are doing? Daily routine, what you are doing. Are you physically working, or you are a sedentary worker? What nature of activity you are having? How you are doing the exercises? How you are doing? How you are working? your pattern of work, your nature of work, all these will come into consideration. The daily routine of the individual will also reflect in the exercising programs. If you are physically working, exercises are not that much necessary. If you are a sedentary worker, you have to go for some specific exercises. That too, you have to design yourself according to the nature of your daily routine. Then one more condition, cancer. Cancer is quite common nowadays. Previously, cancer, here and there we can hear the news of cancer patients, but nowadays here we are having number of cancers. They say that different cancer is a group of more than 100 different diseases. So it is nothing but the replication of cells, duplication of cells, which are not necessary for our body. Usually, when you are doing exercises, our cells will go for their division. Cell division will be there, which results in the growth of the particular organ. But here, the cell which is not necessary for us, the cell which is giving harm to our body, it will go for the multiplication of cells, and it will hinder some of the other physiological activities. So the cells which are not needed for by us, which are doing harm to our body, are replicating, and it is forming as a cluster. It is a tumor. It becomes a tumor. That tumor is considered to be the cancer. All types of tumors are not cancers. Some tumors which are harmful, which are malicious, which are unnecessary, which harm our body, are called cancer. So here you can see the cell division of cell. The normal cell division, one cell is divided into two. According to the nature of the cell, it will go for meiosis or mitosis. It will divide and it will go on. The cell, the first half, you can see a damaged cell or repaired cell. So this repaired cell will come out. It will not stay in our body. It will come out through the suicide bag, lysosomes. In the cell, we might have studied the lysosomes. Lysosomes are otherwise called the suicide bags. So the damaged cell will come out of our body. It will not stay in our body when it is a normal cell division. But if it is a cancer cell division, the ruptured cell, that damaged cell, that malicious cell will divide, and it will, for the first mutation, it will be divided into two. It will replicate. Third mutation, second mutation, it will be 2. Third mutation, it will be increasing in number. Fourth mutation, it will be increasing in number. After that, it will grow rapidly. The rapid growth of these cells will be there. They will multiplicate in an uncontrolled manner. So this is called as the tumor. This will become a bulky one. This will look like a lump. It will become the tumor. So this tumor, which is harmful to our body, is considered to be the cancer. So it won't come out of our body. So whereas in this normal cell division, the ruptured cell will come out of our body some other way. But in this cancer cell division, it won't come out. It will be stagnating inside our body itself. So you can see the lumps in the particular area. What are all the types? Different types we have. Carcinoma. Carcinoma is a cancer to the skin or the internal walls of the internal organs. It occurs in the tissues of the walls of the internal organs. This is called carcinoma. Sarcoma. So these sarcoma will be occurring in the bone, cartilages, fatty muscles, fat, muscle, blood vessels, and other connective and supportive. What are all the connective tissues? Connective, this ligaments are considered to be the connective tissue. In those areas, sarcoma will occur. Leukemia is commonly called as blood cancer. So it is formed in the blood. Lymphoma occurs in the immune system. So cancer occurring in the cells of the immune system are called lymphoma, and myeloma are called the cancers of immune system. Central nervous system cancers. The nerve cells. Commonly it is called brain cancer. Cancer that begin in the tissues of the brain and the spinal cord is called central nervous system cancer. We colloquially call it as brain cancer, brain tumors and brain cancer. So apart from this, common names for all these cancers: bone cancer, brain cancer, breast cancer, endocrine cancer, gastrointestinal cancer, gynecologic cancer, head and neck cancer. So bone cancer, cancer to the bone. Here the bone marrow will be treated. They will try to change the bone marrow. So the treatment will be very costly. At the same time, it is very difficult to do that also. Brain cancer. Brain tumors will become that tumor which hinders the performance is called cancer. So brain cancer occurs in the brain and also spinal cord. The spinal cord. Breast cancer, common among the women. Breast cancer. Endocrine, it affects the endocrine system. The secretions from the endocrine system will be affected because of this endocrine cancer. Gastrointestinal, this colon cancer, commonly called as colon cancer. Cancer in the colon or intestines. Gastrointestinal cancer. Gynecologic, this is the for the commonly for women, the gynecologic cancer, uterus cancer, like that. They will remove the uterus. According to the nature of the cancer, they will go for the treatment. So gynecologic cancer, head and neck cancer, this also will come under the bone cancer, particularly in the neck region. Leukemia commonly called the blood cancer. They will go for transfusion. If it is identified in the younger stage, it is not risky one. They can go for blood transfusion and the individual cancer. If it is identified in the later ages, it is very difficult to cure this. So this blood cancer. Then lung cancer. Lung cancer, main cause smoking and using tobacco. All these things will affect the lungs. Lymphoma, as we already studied, it is in the immune system. Multiple myeloma are also in the immune system. Prostate cancer, commonly in the among the male, just above the prostate glands. This will cause the many causes for this. This prostate cancer will affect the urinary function of the male. Then skin cancer, because of overexposure to the heat or radiations from industries or the radiation from directly from the sunlight itself will, for some person it is sunlight is allergic and it will cause the skin cancer. So then soft tissue to the soft tissues, tissue sarcoma, all these types of colloquial names of cancers. What are all the symptoms for cancers? They'll be always tired. Person affected by cancer will be tired all the times. Always they will feel the tiredness. Unintentional weight loss. They can't predict the reason why they are losing their weight, losing 10 or more pounds immediately, 10 or more suddenly. We can say they are affected by cancer. So unintentional weight loss is one among the symptoms of cancer. Fever. Fever, it won't reduce. Continuous fever will be there. Fever is the common symptom for all the diseases. Most of the diseases, the most common symptom is fever. Then this is because of the failure of the immune system of the body. They are getting the fever. Changes to the skin. The color of the skin may change. The texture of the skin will change. All these changes will be due to the physiological changes of the cancer cells. You'll be having the irritation of the skin. You'll having the itching sensation of the skin. All these will be the symptoms for cancer. Pain, persistent pain will be there. That affected area will be paining all the times. You will have persistent pain. If the degree is more, if it is a chronic cancer, you'll be having the excruciate pain. Unbearable pain will be there. So you'll feel the excruciate pain. All these things are the main symptoms for cancer. Particular area will be paining more. You cannot, you can predict excruciate pain in that particular areas. Then what are all the causes for the cancer? So here they have given some of the data about the occurrence, data of the prevalence of cancer, different types of cancers with their data. Then what are the causes for cancer? Why cancer cells are formed in our body? Because of the use of tobacco. Tobacco is the main cause for cancer, particularly the oral cancer, mouth cancer, neck cancer. All these things will be occurred due to the chewing of tobacco or smoking. So this tobacco has the effect of producing the cancer cells. Then inactivity. Physical inactivity also will lead to cancer. We have to work out our body. Some other means. You have to physically work. The energy should be spent some other way. The excess storage. Some previous studies, some around 20-30 years back, they used to say excess of protein also will be converted as cancer cells. Some studies suggested that also. So then genetics. If their parents or forefathers are having cancer, this also may passed on to their offsprings also regarding the cancer cells. Then environmental factors. The environmental factors such as industrial waste or some hazardous chemicals also will cause cancer. Many studies they have conducted recently. This Sterlite also, they have closed the Sterlite because of all these reasons. Sterlite in Thoothukudi, because of all these problems only they have closed the industry. So environmental factors also will directly influence the cause of cancer. Unsafe sex. So those who are infected, those who are either the partner, when they are infected, if they have the sex, the inflammation will pass on to the next gender, the partner. That inflammation, if it is unattended, it may get more infected. It may it may produce some tumors. That tumor may also become some cancer cells. So unsafe sex is also considered to be the cause for cancer. Exposure to sun. Exposure to sun, the UV rays from the sun will directly affect the skin for some persons. Those who are having some deficiencies, they will be affected with the exposure, sun exposure, and they are prone to the skin cancers particularly. Wearing sunscreen, lotions, and other things that are remedial measures will also help in protecting that. So next one is acquired immunodeficiency syndrome. It is occurred. We are voluntarily going and we are acquiring that. We are finding out from some other mode. So that is occurred immunodeficiency. Immunity. The immunity is one of the major system to fight against any diseases and disorders. So the immune system will be affected because of these viruses. Occurred deficiency, lacking the immunity system. Syndrome, as I told you, set of characters that hinders the functioning of our body parts. So occurred immunodeficiency syndrome. It is caused by human immunodeficiency virus, HIV, like SARS, like this corona. It is one of the virus. Still now we are doing researches for this virus also. HIV also we are not having proper medication. So this AIDS is acquired immunodeficiency syndrome because of the virus called human immunodeficiency virus. So this virus weakens a person's ability to fight infections and also cancers. So when a tumor is found inside our body, it should be fought against with the help of the white blood corpuscles. So when the immunity is less, it cannot fight against infections or cancers. So this is identified by CD4 test, cluster of differentiation 4. The name of the test is CD4. They find this with the help of the glycoprotein. The glycoprotein found in the immune cells. So this test is done for identifying whether they are affected by HIV. The HIV viruses have affected our body or not. So this is the test, CD4 test. If it is, the value is less than 200, it should be more than 200. If the value is less than 200, it is said to be the person is affected by AIDS. So how it is transmitted? The mode of transmission, how the HIV virus is transferred from one person to another person. Having sex with an infected person. One who is affected by HIV, if they are having sex with the partner, they are prone to this AIDS. Then transfusion of blood and blood products. Blood and blood plasma, now the advanced therapies, plasma therapy, like that. If the blood products are transferred from one body to the other body, that is from the infected person to other person, it may transmit from the infected or pregnant women to their offsprings, to the children. If an AIDS person is pregnant, that HIV can be transmitted to the offspring, the child also. Feeding a child, that infected person, infected woman feeding a child, because it is through the blood only. It is transmitted from the main mode is the blood only. So it is transferred to the child also. Sharing of needles with someone who is infected. The needles, the syringes which they are using, that also will cause the mode of transmission. So all these can be avoided to get rid of this AIDS. Sign and symptoms. You will not have any sign of this. The main problem of AIDS is you will not have any sign of this virus. First, you will be having fever. As we already, as we see, fever is the common symptom for most of our diseases. Almost, not most, almost all the diseases, whatever you, virus or bacterial infection, fungal infection, any infection, the first symptom is fever. Then muscles and joints, aching of muscle and joints. You will have the pain in the muscles and the joints. Sore throat. These are the common symptoms for all the viral infections. When you are affected by any of the virus, you will be having the body pain, joint pain, like chikungunya, SARS, any virus, viral infections, you will have all these symptoms. Swollen glands. Glands, you will see the swelling of glands, lymph nodes, particularly in the neck, you will see. Those are having hyper and hypothyroidism also, they will have, the neck will be swollen. So you cannot identify whether it is AIDS or any other diseases. So these are the common signs and symptoms. Unless you go for the CD4 test, you cannot find it out. So exercise prescription. What exercises can be given for the cancer and AIDS patients? See, both the cases, they will be tired, they will be having the pain, body pain, joint pain, every pain will be there. So what exercise can be prescribed for these, particularly for these persons? Aerobic exercises. So aerobic exercises, you cannot go for aerobic dance directly. You can gradually increase the intensity, density, load, anything, everything. First, you have to begin with some stepping exercises. Stand and stamp the feet. On the spot march, like that you have to little bit, you have to start the exercises. Getting to the heart of it. After gaining this, after slow and steady movement of all these things, you have to realize, you have to feel the exercise. It should reach your heart. You should have the feeling of that, because mostly the patients with cancer and AIDS, they will be, after identification, they will be psychologically fed up. Psychological problems will be more among them. So they will psychologically, they will be fed up. So the exercise which they are doing, it should reach their heart first. They should feel the ease of the exercises. Then whole lot of pumping going on. Then only the whole pumping action, the intensity. Concentrate. You have to concentrate on the intensity. First, they have to start with some low intensity exercises that they should feel, that it will help. It will be helpful for me. It will help me to ease out my activities, all these things should be done. Then only you have to go for the pumping action of the whole lot of pumping going on. Then only you have to make the go for the intensity, increase in intensity, which directly results in the pumping action of the heart. Then oxygen consumption and muscles. Oxygen consumption. Then if your that breath labored breathing will be there. If you increase the intensity, labored breathing there. For these patients, if you slightly increase the intensity also, they will get the labored breathing. So oxygen consumption, they have to go, they have to check their vital respiratory signs also. VO2 max and other things you have to concentrate. What are all the fitness benefits of these aerobics exercises? They can understand how our body adapt. The patients can understand how their body is adapting to the particular given aerobic exercise. Whether it is giving any effect on their body or it is worsening their condition that they will feel. So the adaptation of the body should be known by the individual, by the patients. Then these aerobic exercises will help in burning more fat. It also will be helping carbohydrate digestion of carbohydrate. So this aerobic exercise, instead of sitting or lying in, because of their body condition, because of their tiredness, because of their pain, they will not be able to move around, they will not be able to walk around, they will not be able to mobilize themselves here and there. So unless you go for these activities, unless you walk, unless you climb the stairs or anything else, you have to concentrate on this. The metabolism of the food will be done because of these aerobic exercises only. Then what are all the health benefits of aerobic exercises? Some studies have proved that aerobic exercise have positive effect in prevention of cancer. Prevention of cancer, first you have to stop the multiplication of the ruptured cells, malicious cells. The replication of the cells should be stopped first. So these physical activities, these aerobic activities are helping in prevention of the replication of cells. Some of the studies, they have given a positive result. Some studies also have given, it is aerobic exercises are given for treating cancer. That is exercise therapy. Exercises are used as therapy for some of the cancer patients. So all these things will help in the prescription of aerobic activities for the cancer and AIDS patients. The same thing to the AIDS patients also. It's the immune deficiency, that immune boosters are developed because of the activities. So these are all the prescription for cancer and AIDS. So we have almost covered all the diseases. So this unit is also over. So both the papers, the paper exercise prescription for a special population also over. So you'll be having a small test on this. Sir will give you the questions for your internal marks. Hope you understand all.
Yes, sir.
Sir, when the test will be, sir?
Sir, Felix sir will announce you.
Okay, sir.
Okay. So I think we can wind up the class. Do you have any doubts?
No, sir.
Okay.
No, sir.
Okay, thank you.
Shall we leave, sir?
Okay, you can leave. Thank you.
Thank you, sir.
Okay.
Thank you, sir.
Okay, welcome.
அன்லாக் செயல்முறை இப்போது நாடு முழுவதும் தொடங்கிவிட்டது. மிகவும் அவசியமெனில்
Students?
Yes, ma'am.
Class over, ma?
Yes, madam.
Class over, ah?
Yes, ma'am.
Class over, ma'am.
Wind up.
Okay. Felix, sir? Okay, thank you, students. You can leave now, okay?
Thank you.
Okay, thank you.
மேடம் கோர்ஸ் இன்னையோட முடிவுங்களா என்ன இருக்குங்களா மேடம்?
புரியல என்னது?
மேடம் எல்லா சப்ஜெக்ட்ஸும் இன்னையோட முடிஞ்சிச்சுங்களா இல்ல இதுக்கப்புறமா கிளாஸ் இருக்கான்னு கேக்குறேன் மேடம். நாளைக்கு நாளை மறுநாள்.
I don't know about that. You ask Felix, sir, okay? Okay, wait a minute. Just I am calling. Felix, sir? Felix, sir? Oh, I think he is not in online. Okay, you can ask him directly, okay?
Okay, madam.
Okay, thank you all. Thank you.
Thank you.
Thank you, ma'am. Thank you.
Thank you.